Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang inisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates, so it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really, like Simply Nature, that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Talagang sobrang sakit. Sumusuka na ako. Tapos sa work ko rin, hindi ko na kaya talagang mag-isip. Dumating ako sa point na nawala na din daw ako ng malay. Then, nakilala ko si Sir Shyan. Meron silang ganung product. Effect sa akin ng supplement na to is malakas ako. Kahit nagkikimo ako, nagre-radiation ako. Hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, walang ganang kumain. My name is Saida C. Gomez, 48 years old. I live in Quezon City. Currently work is a property manager. Diagnosed sa akin is breast cancer no year 2019. After 2.5 years, is recurrent na siya for stage 4. Affected na yung brain, then lungs and liver. Kumalat na siya. Yung symptoms na naramdaman ko is talagang sobrang sakit ng ulo ko. Gumising ako parang sumusuka na ako. Tapos yung umiiba-iba yung way ng walk ko. Talagang as in vomit dito, vomit dun. Tapos sa work ko rin, talagang hindi ko na kaya talagang mag-isip. Parang lagi akong masakit talaga ang ulo. Na dumating ako sa point na nawala na din daw ako ng malay. Sabi ng mga kasama ko doon. Inaakay na nila ako. Then, yung pinakamatindi is yung dito na sa bahay na talagang inaano ko nung husband ko na gumigising ako pero talagang ayaw kong gumising. Kaya dinala na niya ako ng ER. Tapos doon na sila nag-test. Nagising na nga lang ako, nasa room na. Parang minuto na nga lang, wala na ako. Kasi talagang yung namamagana, swollen na yung brain ko. Nang ma-diagnose ako ng 2019 na I have a tumor, bukol, hindi ako nagpa-chemo. Basta it's natural, concentrate ako sa natural. Then, after ng 3 months, sabi nila, is kailangan ko na daw ipatanggal. So, hindi na siya babalik. So, pumunta ako ng hospital, natanggal naman siya, then, still, natural pa rin na product na aking tinitake. Pero, bumalik siya. Stage 4 na. Kasi nga, affected na yung brain ko, lungs, liver. Actually, may ano na siya, sign na para sa bone. Yun yung mga nakita sa CT scan ko. Then, nakilala ko si Sir Shyan na meron silang ganung product. PPARs na powder and tablets. Yun yung trinay ko habang nag-start na ako ng radiation ng 18. May, nag-chemo na ako. Natapos ko yung radiation ko for 10 session. So, okay yung effect. Nakayanan ko siya. May, nag-start na rin ako ng chemo para dun sa lungs and liver ko. And yung abdominal, kasama na rin siya. Every 21 days, 3 days yung aking chemo. With the help talaga nung Simple Nature, hindi ko naranasan yung nakikita ko sa mga kasabayan kong nagkikimo na nagsusuka, sumasakit, giniginaw, may mga ganun, tapos parang hindi talaga sila makakain. Minsan nga, hindi nila natatapos yung treatment nila. Pero ako, natatapos ko siya, straight 3 days pa, na ang recommended sa akin is dapat naka-admit ako ng 3 days. Since tight lang din ako sa budget, is nag-decide na lang ako mag-uwian. Kasi strong ako, kaya ko. The following month ulit, nakaya ko siya ng hanggang 5 cycle. Di ako nagsusuka, nagugas ng plato, may konti akong pinagkakabalhang tindahan. So, nagagawa ko. When I was diagnosed sa stage 4 cancer, I cried, of course. Hindi mo naman maiiwasan yun. Pero I never felt na hindi ko kakayanin. Parang kailangan ko lakasan ng loob ko para sa family ko, lalo na sa mga bata, sa mga anak ko, maliliit pa sila. Yung husband ko, naiyak siya, syempre. Pero nung makita niya akong lalaban ako, parang nadagdagan yung fighting spirit niya na talagang lalabanan natin to, mami, sabi niya ganun. Narinig ko nga sinabi ng doktor na less than a year ako, pero hindi ako kinabahan. Tinitake ko is PPARS powder, 2 scoop, nilalagay ko siya sa ilalim ng dila para ako matulog. Then 15 tablets every morning, empty stomach. Then sa afternoon din, 15 din ulit. Bumibili rin ako ng cleansing para panglinis. During chemo, radiation, ginagamit ko siya. Effect sa akin ng product, ng supplement na to is malakas ako. Kahit nagki-chemo ako, nagre-radiation ako, hindi ako nanghihina. Kaya kong bumalik sa normal na kilos ko after ng chemotherapy ko. Happy ako sa mga result kasi after 3 months, pinag-CT scan na nga nila ako at saka MRI. Good yung development. Nabawasan lahat yung mga measurement. Siguro yun yung effect talaga ng supplement na tinitake ko. This month is naka-evaluation. PET scan na po ako. Happy ako dun sa result ng CT scan at saka MRI. Kasi nga, yung sa MRI ko, yung sa brain is from 1.09 naging 0.08 na lang siya, yung measurement niya. Then yung sa lungs ko, which is yung chest scan ko, is 9.05 naging 4.05 na lang. I will recommend Simple Nature to the other cancer patient kasi it's very effective for me. Kahit nag-treatment ka at tinitake mo yun, hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, then walang ganang kumain. Hi, I'm Saida Gomez. I have stage 4 breast cancer, metastasis for the brain, lungs, liver, abdominal, and bone. Thanks to Simple Nature, I'm okay now. And I trust Simple Nature.
Simply Nature. My name is Jenny Lay, and you are watching another episode of Simply Nature webinar powered by SMG or Simply Healed Medical Group. I'm delighted to see all of you here today. This is a free webinar, so feel free to tag and share with your family and friends. Last week, we discussed about metabolic diseases, about hypertension, gout, liver disease, and kidney. But tonight's topic is very specific for the guys. It's about prostate cancer with stroke. So to enlighten us, as he's an international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore, you all know him. It's no other than Mr. Shyan Lim. Good evening, Sir Shyan.
Hello, I can't switch on my video. It's been locked. The host stopped my video sharing capability. There. All right.
Okay.
Okay, welcome everybody. It's so good to see everybody today. Oh, I noticed that our viewers are less than usual because today's topic is about men's cancer. So it looks like men are more cavalier about their health, but maybe not. All right, so we're going to cover a very common topic today, which is a very common concern, which is prostate cancer. For me, especially, I'm 49 years old this year. So next year, I have to do my first prostate exam. So I think Dr. Jansen will be talking a bit about that. So tune in. And after that, we have the Ask Me Anything segment. Please feel free to ask any questions you may have. And it's opportunity time now to invite all your friends because we'll be on all the way till about 8:30. So after the short discussion by Dr. Jansen, we'll go into our Ask Me Anything segment. So I'll hand the time back to Jen, who will introduce Dr. Jansen for tonight's discussion.
Thank you, Sir Shyan. Now it's time to hear from another expert with a special patient case presentation. Dr. Jansen Calalan graduated from St. Luke's Medical Center, College of Medicine in 2016. Then in 2019, he was conferred as a diplomat of not only the Philippine College, but also the International Board of Lifestyle Medicine. He is also the president of SMG or Simply Healed Medical Group and a consultant at Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center, Las Piñas. Take it away, Doc Jansen.
Hi, Jen. Hello, everybody. Happy to be here. No? So tonight, we're going to be talking all about prostate cancer. However, this is a special case because we are actually looking into two diseases. Stroke and prostate cancer. So how is there a relation between the two diseases? And also, can one cause the other? And if it does, how? Okay. So first, let's do this through a case presentation because I think through a case presentation it would be more realistic. It's more relatable as well, rather than talking about concepts and theories. Okay. I cannot share my screen. I think the host hasn't enabled it. Okay. For a while. Let me just share my screen so everybody can see the slides. Okay. So here we go. Okay. Now let's begin. So our patient is a 67-year-old male who came in for nutritional intervention. The main reason why he wanted some guidance with nutritional intervention is that 2 months ago, he was diagnosed with prostate cancer stage 3. And together with this, he underwent his first session of radiation therapy. However, he suffered a stroke during that first session. Now, of course, the patient suffered the stroke. The radiation therapy was stopped. It was postponed. Now, the patient is in a dilemma. Okay, now he has a prostate cancer, and one treatment that is good for prostate cancer is actually radiation therapy. We have a lot of success with that. However, of course, the question is how can he recover healthy enough so he can continue receiving the radiation therapy because he, of course, suffered a stroke. Okay, and of course, having prostate cancer, he also wanted to have some guidance on what to eat and what not to eat. Um, if you have cancer. Okay, so the other pre-existing illnesses that the patient has are the it's a it's a handful and quite serious at that. No, some are quite serious, but mainly what we see here is metabolic illnesses, hypertension. The first item, diabetes, are two risk factors that can contribute to stroke. Okay, so stroke is also known as brain attack. So it is when a blood vessel inside your brain is clogged, gets clogged or bursts. So in this patient, I am assuming that probably what he had was ischemic stroke or an artery inside his brain got clogged. Okay, so hypertension and diabetes can contribute to that. Okay, now let's take a look at his medications, the medications that he's taking. So these are the medications like your ursodeoxycholic acid, rosuvastatin, etc. Okay, the first one, ursodeoxycholic acid, is for his gallstones. Rosuvastatin is for cholesterol. This is needed if you have a stroke, if you have had a stroke. Norvasc is a antihypertensive medication. Leuprorelin is hormone therapy for the prostate cancer. Candesartan is also an antihypertensive medication. Clopidogrel is an antiplatelet medication. It is a blood thinner. Citicoline is basically a medication to make nerves healthier. Okay, to increase neuroplasticity. In other words, neuroplasticity is basically how well your nerves adapt to its environment. Okay, and some other supplements. Okay, so let's take a look at his lifestyle. So for his lifestyle, as you can see here, it's actually quite healthy already, relatively, because he eats mainly a plant-based diet, a predominantly plant-based diet. Just take a look at his breakfast, okay? And for lunch, although he had chicken tinola, I think it's just a few pieces, okay? And for dinner, it's fish and essentially all plant food. This diet is correct, okay? Especially for stroke, for and for prostate cancer as well. However, can we still improve this? Yes. Okay. But this diet for me is acceptable already at this stage. Okay. Now let's take a look at his other aspects of the lifestyle. So for physical activity, he goes for rehab because of his stroke. So that is already his exercise. He has good quality sleep, and he doesn't have any vices whatsoever. Blood pressure, this is his vital signs. Okay, so if you take a look at that, his blood pressure is wonderful. His BMI is also wonderful. Okay, and just to give you an idea, this was his biopsy report a few months back. So this is a confirmation that what he has is prostate cancer, and the one highlighted is prostatic adenocarcinoma, Gleason score 9. So what is Gleason score? Gleason score is the metric that pathologists use to gauge whether or not the cancer is aggressive. In this case, the prostate cancer. Gleason score of 9 is aggressive. It's in the aggressive type. Okay, the maximum the maximum score that we can give an individual is 10. Okay, now this is his imaging study. So with this, what we can see is that the tumor is confined within the prostate and there are no lymph nodes involvement and no distant metastasis as well. Okay. Now, let's take a look at the risk of stroke among prostate cancer receiving radiation therapy. Is this significant? Might the radiation therapy been the reason why he suffered a stroke? So in general, according to this study. Okay, as this study was done in South Korea, uh, the findings is that radiation therapy is not associated with cardiovascular disease risk. So that would be one disease would be stroke. No, although the problem here is the number of subjects may have been too small to evaluate any effect. Okay, however, at on face value, radiation therapy might not have been the reason why the patient suffered a stroke. Okay, why? Because number one, if say for example this study is what this study is saying is true, no, the conclusion that radiation therapy may not be associated with cardiovascular disease risk is because of the small amount of subjects. So this statement might not be accurate. Would this then be applicable for the patient? I still don't think so, because it's just one session. Okay, and in principle, what radiation therapy does is that it allows for clotting of blood, clotting of wounds. Okay, and in this patient, since the patient have had radiation therapy, there's a possibility that there must in somehow somewhere his blood clotted and the clot went to his brain. Okay, so that's one possibility. However, would I blame radiation therapy as a reason? No, because it's just one session. Although in theory, it might be a possibility. Okay, so the next question is, how can we help the patient recover so that he can continue his radiation therapy? Okay, so we have to address the pre-existing illnesses that he has. Okay, so one very important criteria for a patient to be a good candidate for radiation therapy is he has to have adequate hemoglobin, because the hemoglobin or oxygen is very important for to generate free radicals for radiation therapy to be effective. Okay, another one very important aspect is the patient has to have a normal functioning immune system, because if your immune system is not functioning well, then radiation therapy will not be a good option for you, because radiation therapy can suppress your bone marrow, hence it can suppress your immune system. Okay, because the amount of white blood cells generated from the bone marrow will be decreased. Okay, and excuse me. And lastly, of course, is incontinence. Since he has prostate cancer, the patient must not have any incontinence. Okay, so he can receive radiation therapy, or else because no, radiation therapy at administered at the lower part of our body can produce incontinence. Okay, so let's now take a look at his complete blood count, his other laboratory works. So in this laboratory, his hemoglobin is 13.3. This is still acceptable, although it's low for males. Okay, but this is still acceptable for him to receive radiation therapy. Okay, is his white blood cell count depressed or very low? No, it's within the normal range. So, in terms of the criterion, would he be a good candidate to continue radiation therapy? Based on this complete blood count. So, my treatment plan for this patient is now this. The treatment approach is curative for the prostate cancer and help him finish radiation therapy. Okay, so aside from the nutritional intervention that I talked to that I prescribed him with, I also prescribed PPARS powder, PPARS therapy. Okay, I prescribed him basically PPARS powder and tablets. Now, here's the thing. Why did I have these two statements here? PPARS powder, 2 scoops twice a day during non-radiation days, and only PPARS powder at night during radiation therapy days, because PPARS powder can interact with radiation therapy. Okay, radiation therapy, the effect of radiation therapy backs on the idea that it can generate enough free radicals to kill or to damage the DNA, okay, of the cancer cell or where it is directed. And PPARs is known to be a very strong antioxidant. Okay, so in that sense, and also microalgae, did you know that microalgae is used as a radiation scrubber? Okay, so with these two known characteristics, known functions of PPARs, it might interact with the effect of radiation therapy. However, we have to know that if the patient undergoes radiation therapy, some side effects, now he may experience some side effects, negative side effects. So we still have to make sure to make we still have to make sure that he remains healthy enough so he can finish the entire treatment duration. Okay, so uh, because of those reasons, this is how I prescribe PPARS powder for him. Okay. Now, before we go into the nutritional aspects of his diet, one last thing: what are the benefits? What are the other benefits of PPARS powder? No, aside from minimizing side effects of radiation, helping the patient recover, PPARS is known to kill cancer cells as well. It can induce apoptosis in cancer cells. Also, it can stimulate the body's immune system, the genetic pathways, so that healthy cells are generated. More healthy cells are generated. Okay, so this is also one reason why I recommended PPARS powder for the patient. And on top of that, last reason is because of the pre-existing illnesses that he has. Okay, PPARS really works wonderfully for these illnesses like his hypertension, his asthma, his diabetes, um, his fatty liver disease as well, mainly because PPARs act on the fatty acid metabolism. It is a very strong antioxidant, anti-inflammatory. It has very strong anti-inflammatory nutrients as well. So in that regard, it is really good for his hypertension because hypertension, one cause is inflammation. Okay, that increases our blood pressure, so it can really help with his hypertension. Asthma is a hypersensitivity reaction, basically an allergic reaction. Okay, so with this, with asthma being an allergic reaction, it's also rooted in inflammation. And since again, PPARS has very strong anti-inflammatory properties, it's gonna be good for the control of asthma as well. For diabetes, the root cause of diabetes is fat toxicity that causes insulin resistance. So PPARS again works very well in inducing fatty acid metabolism. So it will really be very good as an insulin sensitizer. So it's gonna be good for his diabetes as well. And lastly, fatty liver disease. By its name, fatty liver is because of fat. Now, if we stimulate the body's capacity to metabolize fat, it can resolve fatty liver disease as well. And what we don't like about fatty liver disease is that it causes inflammation of the liver. So we go back to the inflammation. So PPARS is a very strong PPARS has very strong anti-inflammatory properties that can also be used as a treatment for fatty liver disease. As also, these are mainly the reasons why I recommended PPARS. So he is really a perfect candidate for this. Right now, of course, this is just using a supplement to treat some of his diseases, which if you will notice are mainly lifestyle related. So we still have to go back to the basics, which is lifestyle intervention. So we have to make sure that he is eating the right foods. And at this point, what he should be eating is a plant-based diet. Okay. Now let's go into more details in the foods that he has to eat and he has to avoid. Okay. Number one food that he has to avoid is dairy. Good thing the patient is not consuming dairy products anymore. Why? Because at least consuming at least 2.5 servings of dairy products per day increases your risk of developing prostate cancer. Okay, compared to those who just drank half a serving.
Also, if you consume more than 2 glasses of milk per day, this increases your risk for developing prostate cancer by 60% compared to those who avoided milk altogether. And why is this so? It's because dairy increases IGF-1 levels. It basically increases IGF-1 levels. No, so what is IGF-1? IGF-1 is insulin-like growth factor. It makes tumors grow. It's a tumor growth promoter. Okay, so if you consume dairy, this can be a problem. Okay, this is just another proof that IGF-1 is central to the progression or the worsening of tumors or cancer. So for cancer patients out there who is listening, you may not have prostate cancer, but you may have other types of cancer. This is something that you have to remember. Do not consume dairy products, okay? Because you risk this happening, okay? So another one is for him to avoid processed meat, okay? Because processed meat is known to be a carcinogen, okay? So why eat something carcinogenic, right? If you have cancer already. So it can, of course, lead to the cancer worsening, okay? And alcohol consumption, it's also a good thing that the patient is not consuming alcohol because there is no upper safety limit in the consumption of alcohol where you don't increase your risk of developing cancer. Okay? So, another one is now we know what to avoid. What can we do to prevent prostate cancer, especially in the lifestyle that we have? Okay, so this came from the World Cancer Research Fund or World Cancer Research Fund International. No? It's an international group that researches cancer. So this is mainly their recommendation to prevent cancer. So when it comes to what the patient should be eating, it should be a diet rich in whole grains, vegetables, fruits, and beans, which the patient is fortunately doing. So the patient is actually on the right track with what he disclosed during when I was interviewing him. But of course, his diet can still be improved by lessening meat intake altogether. Okay, so what would be the proof that this is effective? This study. So this is actually a proof. So this is a study done on prostate cancer. And this study looked at the effect of a plant-based diet and a standard American diet. So what the researchers did was to get the blood of those who are eating a plant-based diet and a standard American diet, and they dripped it on a petri dish of cancer cells. So the plant-based diet stopped the growth of cancer cells by 70% compared to the blood of a person eating a standard American diet, which only decreased the growth of prostate cancer cells by 9%. So the question is, which kind of blood do you want circulating inside your body? Do you want the blood of a plant-based diet eater or the blood of a standard American diet eater? So you choose. Okay. Here's another study that they did, a continuation of that, wherein they look at the PSA levels of the patients. Now, remember, PSA stands for prostate-specific antigen. So when this increases and they found the tumor inside your prostate, that is a telltale sign that you might have prostate cancer. Okay? The cutoff value is 4. So the participants started at a high value of 6. So one group followed the plant-based diet, another group the standard American diet again, and they looked at the PSA level. The plant-based diet group decreased the PSA level by by 0.25 points, okay, which is quite significant because this is reversal of the disease. And the one who's following the standard American diet saw an increase in PSA level, which shows progression. Okay, so that would be all. We can now go into our Q&A portion. Thank you for listening.
Thank you, Doc Jansen. Wow, now we know that PPARS is not only for cancer, it's also effective for stroke, hypertension, diabetes, asthma, and fatty liver disease, or name it. At this point, questions are very much welcome. Just type them down in the comment section below, or kahit Tagalog, okay lang po. But first, I would like to shout out to our avid viewers. I would like to acknowledge the presence of Miss Janet Koo from Child House, Miss Lily Lu from Malaysia, Eka, Myra Rivera, and Fon San Jose. Ayan. And to answer your questions, in this modern world filled with noise of different health opinions, trust the ones from the experts. So I'll call on Mr. Shyan and Doc Jansen again.
Hi, thank you, Jen. Doc, so good to see you. I mean, we were just chatting a while ago. Yeah.
Yes, good to see you. Good to see you.
You know, I was reading some of the feedback that we got from registrants. One was from Arlene. She said that her husband died of metastatic cancer 2 months ago. He had hormone therapy, and then she's so sad she was not able to learn about alternative care. I think our heart goes out to you, Mama Arlene. In fact, we were just talking to Dr. Jansen. You know, I asked Dr. Jansen and myself this important question. If we were ever diagnosed with cancer, what will we do? And both of us said the same thing. We'll both drink a mug of liquid pea extracts every day first, right? So, and then we will still visit the oncologist and we will set trigger points. But as we converse, we realize, like many of you, we would like to start off with natural and hope that it will work, but we will always have a safety net of oncological protocols. So my heart goes out to Ma'am Arlene. I totally understand, sayang, that we were not able to share the alternative protocols that we have, such as PPARs. But thank you, and I hope you can, I guess, make the world a better place by sharing with others what you have found here tonight, so that others can find hope, and that you can also find hope because you brought hope to others. Yeah.
Yes, I can see a lot of questions coming up and thrown privately. So let's start the live AMA or Ask Me Anything question. First question coming from Sir Junie. Doc, can I get prostate cancer in my 20s? Is this true, Doc? Because it's a common thinking that prostate cancer only affects older men.
It's very rare. I haven't encountered any who have prostate cancer at age 20. Usually, prostate cancer really is an illness that plagues men who are in their late middle age, so 50 and up to senior years. But mostly men who are in their senior years already.
Doc,
Yeah.
I'm curious, is there a reason why older men get prostate cancer and younger men seldom get or never get? Sorry to put in a difficult position.
It's the natural course of disease. It's the way it is. It's the way it is. So, well, luckily, no, unlike breast cancer, because for breast cancer, we are seeing more and more younger women who get diagnosed with breast cancer, but not for prostate cancer. Because for prostate cancer in and of itself is very indolent. Indolent meaning it's slow growing. If even though you have it at an earlier age, you can die of other reasons, not aside from prostate cancer, because it is slow growing. Yeah.
Well, that's just good news that for men, and it's really good news because men don't take care of their health in general compared to women. Yeah. So next question, Jen. Jen, you're muted.
Sorry, sir. Okay, I think that answers the question of Miss Lilibet, that what age do prostate cancer usually occur? So her next question is, what are the common symptoms?
Common symptoms of prostate cancer, most of the time, you don't feel anything. But when you do feel something, the tumor have grown significantly already. So what symptoms would it be? So it is symptoms that causes a blockage in the outflow of urine from the urinary bladder. So what can we expect here? Number one is difficulty of the urine to go out. So when you're younger, right, you just relax and urine flows out, right? At this point, even if you relax, it doesn't go out. You have to strain yourself so the urine comes out. Okay, so that's one. Another one is the arc of the urine is slower compared to before. Another is the pressure. You can feel that. I know men will, yeah, you will understand. No, the pressure seems not that strong anymore. Another one is urinary frequency. So you urinate quite a lot. It's because your urinary bladder gets full quite frequently. That's why you have an urge to urinate frequently. Okay, that's urinary frequency. And because of urinary frequency, at night, you tend to wake up to urinate. So that's what we call in medicine as nocturia, which is a significant risk factor for lower urinary tract symptoms. Okay, so those are just some. No? Yeah.
Thank you, Doc Jansen. Our next question from Sir Jose. Does high PSA score means you have prostate cancer?
Not always. Not always. Okay? Because an inflammation of the prostate, so prostatitis, can elevate PSA as well. Benign prostatic hyperplasia or BPH or benign prostate enlargement can also increase PSA. But you do not have prostate cancer. Okay? The only time that we suspect prostate cancer, high suspicion of prostate cancer is when you have a tumor in your prostate, as proven by imaging studies like MRI. So MRI is the ideal imaging modality to be used for prostate cancer. Okay? So once your PSA is high, there's a tumor inside your prostate, the chances of diagnosing prostate cancer is high. The confirmatory test would be biopsy. Okay?
Okay, thank you so much, Doc. Our next question is thrown privately from Miss Maria Charity. Her question is, what is the cause of prostate cancer?
The cause of prostate cancer is lifestyle. It's more than genetic reasons. So it's really mainly from the food you eat based from what I've shown you. It's dairy, eggs can as well. I did not show you anymore because of time constraints, but eggs is also one. But the most impactful one is dairy consumption and processed meat consumption as well. And if you do have other diseases like our patient, he has diabetes, hypertension, etc., especially diabetes, your chances of acquiring prostate cancer significantly increases, especially if you have diabetes.
Wow.
Yeah, I think Doc, that's the reason why normally, even though this is a cancer program, many questions about cancer, solving your basic metabolic problems like diabetes, high blood cholesterol, hypertension is also important. I was kind of stressed at some point and my blood pressure went up a lot and I realized I haven't been exercising. Believe it or not, my blood pressure point dropped 15 points just by running hard, So yeah, it's I feel like I cleared my blood vessels. You know what I mean? When you exercise and you push yourself. Not to mention that we eat so much salt, and it was a long time since I sweated so much and really sweated out the salt as well. So lifestyle is really such an important thing. So is taking care of yourself, knowing how to supplement, knowing what to eat. Yeah, that's all part of staying cancer-free, everyone. And of course, to enjoy your life so that you not be diabetic and so on and so forth. Yeah.
That's true. Okay, next question coming from Miss Josephine Chua. Can PPAR's gel and capsules, I think it's the same, soft gel capsule extract, okay, be taken while undergoing chemotherapy for breast cancer with bone metastasis? Or do you need to rest a day or two after chemotherapy? What is the dosage, please? Oncologist does not want any other medicine or supplement. And thank you, doctors.
Okay, let me take this one. Now, with my experience and with what I have read in the medical literature, is that um, PPARs and the PPAR agonist, it can be taken while undergoing chemotherapy. But the question is, what kind of chemotherapy are you receiving? I have to know that first. But in general, here's two ways on how it can go. You can take it as together with your chemotherapy. That's one. Another one is we space it out. So remember, if you are undergoing chemotherapy, there are cycles. So say for example, you're scheduled to receive chemotherapy once a month. Okay, so you received it on Monday, and after 4 weeks, on the fifth Monday you receive, on the fourth Monday you receive chemotherapy again. So that's in cycles. So in between, you can receive PPAR protocols to help your body regenerate. Will it interact with the chemotherapeutic drug in the sense that will it influence the outcome of cancer? It can. It can, but not negatively. Okay, even it's positive. It's positive in
Positively.
interaction.
Wow.
Yeah. So there are chemotherapeutic drugs that goes hand in hand with PPAR protocol. So it can make the PPAR protocol more effective, and the PPAR protocol can make the chemotherapeutic drug more effective as well. Okay. So it has a synergistic effect. Okay, one such chemotherapeutic drug is capecitabine or Seloda. Okay, so that's one. There are others, but the others I would advise to space it out. Okay. Do we need to rest a day or two after chemotherapy? Again, it depends on the chemotherapeutic drug that you are prescribed with. So I suggest for you to consult. So we can study the case, we can discuss and see what works best for you. Okay, so yeah, I would like what you indicated, it's paclitaxel. Yeah, this is a type of chemotherapeutic drug that we have to space it out. Okay, we have to space this out. Yeah, I think that's it. No, did I answer the question? Okay. Since you're asking if soft gel capsules can be okay to use, yes, it's okay. However, for me, my experience is so I can get the best effect. If the patient can afford liquid, I'll go for liquid. If not, I'll consider powder because powder has a more sustained administration of PPAR in the blood. It's more sustained and it's sublingual, so it goes directly to the bloodstream. So the absorption is way better. Although the liquid absorption is also quite good, but yeah, it is relatively more expensive, of course. So we have to balance this out. So yeah, I suggest for you to go a consult really, so I can make the best recommendation.
And I think this is so important, Doc, and for the viewer, Ms. Josephine, because, you know, right at the start of this program, a viewer shared about not being able to find more options. So for cancer, it's always the issue of not doing enough. You know, imagine you already put so much effort, already going through so much stress, difficulty, going through therapy, which is definitely not easy. It's sayang not to take another step to get more clarity, to be more sure. I do understand if finances is a consideration, but I guess manage to the max that you can, because it's so we already invest so much when we are fighting cancer. It's so sayang to miss to actually open a door for recurrence later or any complications just because we don't take an additional step. So for Ms. Josephine, I do encourage you if you can, not if you can, I do encourage you, go and have a consult with Dr. Jansen, talk more, let him also help you, take the opportunity to ask questions like, Doc, when I am declared cancer-free, when I finish all my 12 cycle, what next, So there are actually many questions you can ask to prepare yourself for the next stage and to get yourself all ready. Doc, I do have one question. Some of our oncologists who use our products, is because the patient can't take the chemotherapy, like have complications or it's really tough. So for patients who, for example, their last session was so tough that they barely made through it with all the side effects, one of our concerns is that taking PPARs at the same time would like lessen the impact of the chemotherapy. We want the chemotherapy to be as strong as possible. But for patients who are very weak, would it be possible? Would it be a scenario where you say, that you might consider taking it like immediately the next day or even the night before, the night after? Like, for example, you just had your chemotherapy session and first session you were fine. Second session, you're like, oh my God, it's so different from the first. You feel so bad. Is it okay to then say, maybe I take the PPARs because it looks like my body can't take it this round? Yeah.
Yeah. In that kind of situation, then yes, I will consider shortening or closing the gap, the overlap between the two. I'll give you an example. No, there was this patient of mine before. She had breast cancer, stage 4. She was quite reluctant to undergo chemotherapy because the side effect was really heavy on her. So when I saw her, I tried to convince her to go back to her onco and receive chemotherapy again. But of course, together with PPARs. But in her case, I gave PPARs all throughout, even when she was receiving chemotherapy. So chemotherapy and the PPARs liquid were taken together side by side. Well, lo and behold, the pain that she was experiencing went down. She was able to rise up again because the patient, when I first saw her, she was bedridden. She was able to get up, go to the restroom, do the basic stuff. Pain lessened until such time that she was able to complete her chemotherapy, and it reached to the point that she was able to go outside, to go to the mall and go shopping. This was during the height of the pandemic. Okay, so it was really good news for her, and the chemotherapy that she was receiving, it was even cut short by her onco because she responded really well.
Wow. So again, to everyone, it's so important. Explore all your options. The PPAP protocols and what Dr. Jansen is sharing with you with lifestyle change in tandem with it is something that you can do very safely, together with your whatever treatment that you are going for. So thank you for the questions. And Josephine, I hope you have your answer. So if in the event that, that particular day, that chemotherapy session was like unexpectedly harsh, that your body can't take it, it's okay for you to take the PPAR soft gel so that you will recover faster. So that again, it's so that you're ready for the next round, right? So it's easy to understand. What I guess I want to assure you of is there is no contraindication. That means taking PPARs together with chemotherapy won't create a negative reaction. What we are just concerned with is that we want to maximize the impact of the chemotherapy. We are just concerned that sometimes the Simply Nature PPAR helps you recover so fast that we lessen the impact of the chemotherapy, but there's no danger of it having complications. Again, if you feel really terrible, especially terrible, and you don't feel well after your chemotherapy, that is a good time that you want to take so that you recover quickly. Yeah.
Wow, that's very inspiring. So for those of you who wish to have a consult with Doc Jansen Calalan, the link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist, Beth, will reach out to you shortly. Our next question is thrown privately from Miss Cecil. Her question is it safe to take atorvastatin, metformin, and fenofibrate even if I have polymyositis? It's an autoimmune disease with muscle weakness. So what are your recommended products to substitute of the said medicines?
It is so fine. It is fine to take those 3 medications when you have polymyositis. It will not worsen your condition at all. In fact, it will help you manage of course, your blood pressure, your cholesterol levels, to what the medications are intended for. Now, do we substitute this with anything else? Not at this moment. Here's how I will approach it. I will not stop taking those medications, but I will begin by changing my lifestyle and start taking PPARs. Okay, because with these medications, it is apparent that you have issues with your metabolic health. Okay, you have high blood cholesterol. Okay, you have probably you have high blood pressure. Okay, so Simply Nature PPARs, like what I have mentioned a while ago, it can really help with metabolic illnesses. It's a big help because mainly before, no, way before, when PPARs was just starting, it was just discovered. It was mainly used for metabolic illnesses. Okay? Later on, cancer just uh, uh, came out.
Developed.
It just developed, yes. But from what I understood is first it was mainly used for metabolic health, cardiovascular risks at that, no?
True.
So
True. Yes,
yeah,
true.
start taking you can start taking PPARs probably the tablets, then do the necessary lifestyle change, then slowly probably the day will come that we can you can already stop taking the medications. But will I substitute? Not at this moment, because the purpose of the medications that you're taking is really to lower your risk of lower your cardiovascular disease risks, which these medications are doing a great job. Okay.
Thank you
Yeah,
so
again, we have so many clients and patients with metabolic syndromes that got well. Even Doc Jansen, I remember about 2 years ago when I first talked to him when we were talking about starting his program. One of his lamentations, right, was that he sees so many metabolic syndrome patients day in, day out, and it's basically they're not controlling their diet and they're always on maintenance drugs. So right now, but he was able to help many of them get off their maintenance drugs. And not only Dr. Jansen, we have so much experience with patients being able to get off their maintenance drugs. What's important is be responsible in the way you do it. Don't just drop it overnight. You gradually drop. Remember, the drugs are there to help you maintain stability so that you have no surprises, right? And then taking the PPAR protocol is to solve the problem at the root cause so that you will be off your maintenance drugs in the very near future. Aim for something like within 3 months. After that, you're free of maintenance drugs.
That's true. As a customer relations officer myself, I experienced this with all of my clients.
Right.
And
So,
again,
so Jen, your clients are able to get off their maintenance drugs.
yes.
What's the most common? Diabetic, high blood pressure, or high blood cholesterol? Which are the most common ones that help?
You know, Sir Sean, I think they go hand in hand.
Yes, you are
comorbidities.
right. If you have diabetes, you probably have high blood cholesterol as well.
Yes. And to follow is their kidney and the liver.
Yeah,
So
so everyone, get started, and your health will also, your illnesses snowball, but your health also snowballs positively. Once you get one sorted, the other one gets sorted as well. Yeah.
that's true. And that answers the question of Miss Lilibet, if can PPARs help with hypertension? So that's an
Definitely.
absolute yes. Yes. Then
Okay,
next question.
sorry. Just wanted to share with everyone, I take a lot of PPARs. So how come just now I said that I had hypertension? So I just want to share with yeah, I'm not contradicting myself, right? It's like saying you run every day. How come you get fat? Because you eat a tub of ice cream, but you only run 20 minutes. Okay, so I think it is important. Just because we eat right doesn't mean that stress does not affect us. It certainly means that if I was not on PPARs, my hypertension would probably be far worse than it is. But then again, it also goes to show that just because you take PPAR protocols does not give you the liberty to be totally free and do whatever you want. So even though I was taking lots of PPARs, my hypertension was still a bit stubborn. It was about like 150 on average, which is not good. But the moment I started running, because I was also on PPAR, it just dropped boom, 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 within few days to 135, 128, yeah, and then so it was very quick also. That means you've got to really take Dr. Jansen's advice. You take my advice to eat PPAR tablets, but you got to take his advice to also exercise and watch what you eat. And together, you're going to get your health back. Very easy.
So we're almost at the end of the webinar. This will be our last question for tonight. From Mr. Teodolfo, can PPARs cure prostate enlargement? What is the protocol best for prostate cancer? Can we cure it with tablets or capsule?
This is a very good question.
Yeah.
Okay, I want to approach this in two ways. So I'll give you an answer, and I'll have Sir Shad give you an answer as well.
Okay.
So, in terms of the product's efficacy, I'll let Sir Shad answer you because he's the first expert. I mean, what I do, I just base it on what he says. Okay. So here's what I have experienced as a clinician. There are patients that gets well with just PPARs alone. I have encountered those patients. Now, the question is, can I get well if I have prostate cancer? Can I get well if I don't undergo surgery? I don't undergo chemotherapy? I don't undergo radiation therapy? Yes. The study that I have shown you is a proof. Okay? It's a proof that you can. And that is just using a very intensive lifestyle intervention. So, what do I mean by a very intensive lifestyle intervention? It's mainly eating 100% plant-based diet. It's exercising every day. You have mindfulness exercises. That's a mental exercises, stress relief exercises. Okay. So it's possible. As you can see, in the study, the PSA of the participants went down. Okay. So the question of, is it possible? Yes, it is. Okay. Now with PPARs is an intervention that would be done on top of the lifestyle intervention that you will do. And I have encountered patients who have done successfully so with prostate cancer. Okay. Now the dose. Okay. The dose that I have experienced that worked well or the products that really work well is liquid, powder, and soft gel. Now, I have answered you the clinical aspect, and I leave Sir Shan to answer the dosing, the mechanism behind it. Okay, so I give the floor to Sir Shan.
Okay, let's start with the question again, Jen.
Okay.
Just to make sure. Yeah.
Okay. So, wait lang. I deleted it. The question is coming from Mr. Teodolfo.
Can PPARs
cure prostate enlargement? What is the best protocol for prostate cancer?
All right. Okay. The straight answer is yes, it is possible. The second thing is, will it happen to you? Depends on your body's condition, right? Depends on whether you have any complications. But the way PPAR works, right, it will address all the root causes that cause most of the root causes that cause your prostate enlargement and things that lead to prostate cancer. And it will create an environment and mechanisms that fight your prostate cancer. So if you work with the product, such as by spending time consultation with Dr. Jansen and making sure the other aspects of your life is working together with the product, then yes, you have every good reason to believe that you have a good shot of getting completely well. At the very least, your condition will improve. It will also put you in a better position in the event that you need additional protocols, right? Be it conventional or natural. So it is the correct first step to take. Be hopeful as you take it. If you're very compliant, then you will see good results. If there is some abnormality with your condition, cancer is something that mutates and changes, even more slow ones like prostate cancer, anything can happen. But don't be very assured that even if the condition, some unusual things happen, you are in a better position to deal with it. So I think my answer is very clear. Yes, it will work and help you. Now, if you're not getting the results that you want immediately, don't think that it's not working, all right? Just go back for a consult so that we can examine what other areas could be the obstacle. And then it's also possible. Remember, I share with everyone that don't think that cancer is you find a one-trick bullet to deal with cancer. Cancer is a moving target, right? It mutates, it changes. But you do know if you get your foundations right, you are in a good position to win this fight. So start with the protocol. And I like Dr. Jansen, if you actually have cancer, I would always recommend start with the liquid because it is strong. Okay, you want some momentum. And then after that, speak honestly either with our customer service reps like Jen or Beth and Dr. Jansen, right? If you have financial concerns, please share with your doctor, share with Jen, honestly. No worries about it. You're not the only one with financial limitations if that is you. Why? It is important part of our advice on how you can create a strategy that you can finish. Diba? Sayang, when things are going well, suddenly the money run out. Okay.
Yeah.
Then the treatment is in vain. So always share your ability to continue the protocol. But the good news is when you start strong and when you see good results, you do have the option of, right, going down on a more financially manageable protocol. And then after that, you will still see good results. If the results slow, you can go back on the stronger protocol and continue your progress. So there are many options, but every one of them is positive. So I hope to hear good news from you, sir, that things will improve. Yeah.
Thank you, Sir Shyan. I'm afraid that's all we've got time for today. So sorry. If you have any follow-up questions, don't worry. We will answer each of your questions next webinar or via direct message. And just before we say goodbye, kindly give our viewers your parting words for tonight.
Okay, I saw a question and I'll use that as my parting words. Someone asked, how do you cure fatty liver? Okay, first of all, stop eating a lot of fat, all right? Okay. So now, of course, just because you stop eating something or you eat less of it, there's always the issue of you're not getting well fast enough. I mean, you want your condition to improve quickly, right? So I just want to share with you by PIPA tablets. You don't even have to go anything more soft gel or powder. Just PIPA tablets alone, and it's a plant-based whole food, will accelerate the positive choices you make in your lifestyle change, right? So if you're going to exercise and you take PIPA tablets, you're going to find the result of your exercise is going to be better and more effective. So that's my last word, is that I hope everybody understood that the protocols we share with you and the approaches to getting back your health and healing is not only one aspect. You combine it, you're going to see a magnified effect. So with that, Dr. Jansen, share with us your last words so that we can all be healthy and handsome like you. Yeah.
Thank you. But here's the thing, no? So our topic for tonight is prostate cancer. And prostate cancer, again, is a cancer that is very slow growing. Hence, the prognosis for prostate cancer is very high. It's it's at least 90%. Okay. Even if you have stage 4 prostate cancer, the prognosis is quite good actually. The 5-year survival rate.
Wow.
It's quite high. I think it's at least 70%. So
Wow.
consider that it's cancer, right? At least you have that assurance that hey, if I do something right at this moment, then probably I can still live longer Okay? So, having said that, if you do get diagnosed with prostate cancer, make sure you do everything in your power to treat it. Okay? Use whatever oncologic protocols your oncos recommend. If you have to undergo radiation therapy, surgery, or whatever, consider them. Of course, there is also the thing that holds us back because of the side effects of these treatments, because these treatments can affect the quality of life that we have. So we also have to consider this very important aspect. Okay, will it suffer? Will undergoing these treatments influence the quality of life that I have? If so, then we have to find those trigger points, and by having a very good discussion or a very well detailed discussion, that's the only moment that we can have that we can find a proper decision. Okay, arrive at a very wise decision at that. So it may not be all uh, oncologic treatments to approach cancer. We also have to consider other aspects, other treatment modalities that we can probably utilize so we can preserve that quality of life that we want, right? So if you're someone uh, that is in a position and you have this dilemma in your mind, then rest assured that we can always have something that we can do for you. Okay? So that would be all for me. So I'll give it back to Jen. Thank you, everyone. Thank you, Simply Nature, for having me.
Oh, wait, Dr. Jansen gave such a good last word. I need to follow up on his last word. Okay, to everyone, I just want to say something. If you are looking for a natural way to treat your cancer, I want to say that this program is the best program here for you. And Dr. Jansen is the best doctor you want to consult with, because we understand, and we're going to help you treat cancer naturally. However, we're going to do it responsibly by having trigger points, which means there will be points that we decide, let's go all out, treat it naturally, but we also understand if this or this or this happen, we've got to do this. I think that's the best approach to anyone who wants to treat their cancer naturally. Treat it with a safety net so that you don't put your life at risk, right? So we are fully with you all the way to treat your cancer naturally, but we are also going to be there to draw the lines for you so that you know exactly when you might consider new options and not just stick with natural. But, we want to do our darnest, because if it happens to me too, I would also like to treat my cancer naturally before I use any oncological protocols, right? So with that, we'll hand the time back to Jen.
Thank you, Doc. Thank you. Okay. So, we hope to see you all in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week, September 21, we have another detailed patient case presentation. The edge of taking immediate action, an effective formula through lifestyle and diet. And lastly, we are excited to invite all of you in a very special in-person or face-to-face health seminar on October 14. That's Saturday, 8 a.m. to 11 a.m. in SM Aura. Yes, limited slots only, so book your seats now. Do not miss out on free giveaways worth 2,000 pesos. And we're all here to invest in our health and happy payday. And Simply Nature PPARS is also for healthy people like me as prevention. If you didn't know, for as low as 650 pesos, you can start your health journey with us via official Shopee or Lazada Mall. So do not wait for the holiday rush to get the best gift of health. Thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.